Hello, everyone. I'm Dr. Jeffrey Kyle,
And I'm Dr. Alvaro Raimunde.
and we're from PAK Pediatrics. Today, let's talk about oral care in the infants and children. And today, we're here with two very special guests from Sprout Dental.
Hi, I'm Dr. Kady Schlosser.
And I'm Dr. Christina Amato.
Great. So let's just jump right in.
PAK Pediatrics presents.
So we thought that we might kick off this podcast series again after a little bit of a hiatus with some pretty cool topics. We do have a lot of things we want to talk about, so we are going to break it up into a couple episodes. But let's just go right into it. So today, like Jeff said, we're going to be talking about general dental hygiene. It's a really important topic, and not everybody gets right.
And it's very difficult a lot of times to access dental care for small children. And sometimes for us, it's hard to know exactly when to send a patient to the dentist, especially in the early years. So I think a good thing for us to maybe start with is, when do we start to care for a baby's mouth? We often get asked, do I start rubbing out the mouth when the baby's first born? Do I wait until they get their first tooth? When should we actually be starting to tell our parents to start taking care?
Absolutely.
So I think that a good general way to look at it is as soon as those teeth first come in, because there is a range of ages where you first start to develop teeth and erupt teeth. So early normal would be maybe as early as 3 months. Late normal might be as late as 18 months. So there is quite a range for this. So I think first and foremost, if you can kind of carry that through, but at the same time, that desensitization, getting in there, getting them used to those stimulation when they're early is also important. So focusing on the eruption of the teeth is one great way, but also just focusing on desensitizing. What would you think?
So as pediatric dentists, we specialize with children, obviously. We definitely want to see them, like Dr. Kady said, as soon as the first tooth erupts. There's something there that we can provide, that education. We can start cleaning off that plaque. We can start, showing parents how the proper usage of toothpaste, toothbrush, things like that. So I know that the American Academy of Pediatric Dentistry does recommend either by the age of 1, see a pediatric dentist, or 6 months after the first tooth erupts.
So how about before that first tooth erupts? I get a lot of parents ask me, should I be brushing the tongue? I see white stuff on the tongue. Do I use the finger toothbrush? Do I use the banana toothbrush? Are there any specific products we use? Do they even have to clean the tongue?
Yeah, so I think that it is the biggest takeaway that can happen when you start early on is just getting that child used to being in the mouth.
Habit forming.
Yes, exactly. And not just for the child, but for the parent as well. That being said, when they are infants and everything is crazy, you've got a new baby at home, you've got a million things to do, you probably have, other kids running around the house. We don't need to get crazy. We don't need to start getting in there at like 1 month of age. So I think like in a reasonable time would be probably around the age of 6 months, because that's when we would expect those first teeth to erupt. And if it happens to happen earlier, then they can kind of get in there earlier. But I wouldn't go crazy. There's so many things that parents have to be concerned about and be thinking about. And so try to keep it simple and just giving them some kind of simple guidelines. So like Dr. Christina had said earlier, we do want to see those kiddos in the dental office by age 1 or 6 months after those first teeth erupt. A great motto you can kind of talk to about your parents is get it done by age 1. Get it done by age 1. It's simple. It's, something in your office you can teach your nurses and your PAs and even yourself, that's very simple. Just get it in their head because trying to like get all those little nuances of getting it just right, if we can just get it done by age 1, we can help take it from there. So everyone wants to be perfect these days. And we can't all be. So we just try to like focus on like simple kind of small points going forward. So it would be great if they can get in there and they can desensitize and so forth. But we don't always have to be perfect all the time.
So when that first tooth comes out, what do you like the parents to really start doing to that tooth? Is it taking some water on a small training toothbrush, or is it moving forward right with fluoride toothpaste right when that first tooth comes out on a child's toothbrush and really get them scrubbing? I mean, how do you approach that?
Absolutely. So ultimately the goal of, cavity prevention, as well as we want to remove the plaque that's on that tooth. So the bacteria film that's on that tooth. So if all you can do is wet a terry cloth and wipe that tooth off, it's that mechanical removal of the plaque that counts. Mm-hmm. The fluoride, yes, is fantastic. It's an added benefit. When they're young, we do under 3 will be the tiny size of a grain of rice, very tiny amount of fluoride toothpaste. Once they hit 3, it's the size of a pea. So, size of
rhymes.
Yeah, it sure does.
Yeah, I like it. Very good.
So at 3, it's the size of a pea. So that's the guidelines that we go by. But like I said, that mechanical removal of that biofilm on that tooth is the most important at that early stage.
Mm-hmm.
And what I'd like to add to that is when it comes to fluoride in the toothpaste, obviously that's a personal decision. But the reason why we would want fluoride on that toothpaste right as those teeth come in is because when those teeth first come in, they're not fully formed. And they are in a very susceptible state of developing cavities. So if we can integrate fluoride into that structure of that tooth, that child will have a stronger tooth in the long run and be a lot more resistant and resilient to future cavities. So there is great benefit to starting with just that little tinge, I always say just enough to get a little scrub in there. And you can scrub it on and you can wipe it off because we're not super concerned about them swallowing it. We just want to get it topically on there. So if you can get it on and then just wipe it off, that tooth will pull that in and that will be a stronger tooth in the long run. So
yeah, I feel we can talk a lot about fluoride. Mm-hmm. And actually, if you guys want to hear more about fluoride, comment down below in the comment section and tell us that you want a video on fluoride. And we can certainly do a whole segment just
Absolutely.
on fluoride because there is a lot of controversy and a lot of pros and potential cons. Mm-hmm. I think it would be a pretty cool topic. So let us know if you want to hear more about fluoride. What about flossing? Should babies get their teeth flossed? But they only have 2 teeth, right?
Yeah.
But they fight me. They don't like it.
Yeah. Again, it's kind of getting them into that routine. So most children, those teeth don't really start to pull together until 3 going on 4. And that's when we see a big increase in that flossing. So these front teeth, I mean, you could have spacing and so forth, but if you start those habits early, you're going to be able to floss much better and easier.
They won't fight you
when it really matters. Yeah.
And I do encourage the you do, I do technique with the parents and the patients. Show if the parents flossing, the child sees it, and that way they want to mimic what the parent is doing. Even at 2 years old, they might not know what a little flosser is, but they know that it goes in between the teeth or it hits their gums. They understand that little feeling that it's not painful, it's just different. And like Dr. Kady said, it's just getting them into the habit of doing it makes a very smooth transition into toddler and early adolescent as well.
It's also kind of like I always tell the parents, it's like walking around with bare feet. And if you're not used to walking around with bare feet, you suddenly step out on some pebbles and ow, that hurts. Well, when it really matters and they're at that visit and we're like, we need to start flossing and they've never flossed before, guess what? Ow, it hurts. Right. The kid's screaming and there's blood because there's gingivitis. And now now it's going to be, again, just a big process. And a lot of parents just kind of throw up their hands with that because we have so much going on, as parents. And the last thing we want to do is deal with a screaming kid right before bedtime. Like, sometimes it's just hard to get that toothbrush out at the end of the night. So we try to make things as easy as possible.
And we'll probably talk about it in a further episode, but gingivitis doesn't have to be this nasty, super swollen gum, right? It can just be any mild inflammation of the gum.
Yes, yeah.
And localized, it can be generalized a lot of the times. You have a child or the parent comes in and says, oh, well, his gums bleed, so I stop brushing. And that's not what you should do. That's basically the gums telling us, I'm unhealthy, I need to be cleaned. And, we want to continue that cleansing of the gums with that localized gingivitis. And flossing will help. If you go 2 weeks without flossing, you probably will have some localized gingivitis. Even the best oral care,
Yeah. I would say we throw in a tip.
Yeah, pro tips. Love it.
Okay. So while we're on the topic of flossing and gingivitis, is I like to play a little game with my kiddos. And after we're done flossing and after we're done brushing, they have to spit into the sink without a rinse beforehand, and we look to see if there's blood in their spit.
Sounds like a great
game.
Yeah.
Yes, and if there is, they have gingivitis, and then we track it down in their mouth, because if you look right after that, you can tell where the bleeding is coming from, and then we do better. And really, like gingivitis on kids, that'll resolve just in a couple of days, but it can be a vicious cycle, like Dr. Christina said, is we see the blood and, we're brushing too hard, and then it just becomes worse and worse, and that's where we can sometimes develop cavities.
I think it would be good for us to sort of segue a little bit here with, we sort of talked about what we as caregivers can do to the mouth to help prevent cavities and prevent bacteria formation through using fluoridated toothpaste, brushing the teeth, and flossing. But what other things can parents do out of habit to sort of prevent cavities that are not physically, doing something to the teeth? So habits. So a lot of times we as pediatricians counsel our parents and the kids, watch foods that are very sticky and sugary, because that could help increase cavity formation because of the sugar getting stuck on the teeth. Sippy cups and, bathing your teeth in sugary drinks, constantly snacking, never having a break. So you guys just want to elaborate a little bit? I threw out a couple of teasers.
No, absolutely. My soapbox is fruit snacks. I just Pit and fissure cavities, which are the biting surface cavities. Those are the most common in children. And those are caused, mostly by, our diet, what we're eating. And fruit snacks stick in the little crevices. And no matter how hard you brush those teeth, that little tiny, sticky stuff is not coming out of that deep, deep valley on your tooth. So that is those fruit snacks. It's like, oh, well, I didn't realize I'm packing fruit snacks for lunch. They're easy, and they really are, and they are delicious. But, it is hard, especially on a child that is difficult to brush every night. So those are one thing that I really am I'm against.
In turn, even I often tell parents that if they're giving vitamin supplements over the counter, and no child likes to take the hard, like Flintstone vitamin anymore. It's all the gummy ones, and a lot of those vitamins, if you turn over and just look at the ingredient, the first ingredient is sugar. It's not the vitamin in and of itself.
And I do there are some vitamins that, even the gummy vitamins, there's like a honey component, no sugar added, things like that. But it's
it's still a sugar.
It's still sugar. It still breaks down. Even there's part of those fruit snacks and gummy vitamins that are break down to carbohydrates. There's those type of foods like that. So even chips, pretzels, those kind of snacks also target those pits on the teeth. creating a perfect environment for those bacteria to thrive. And that's the first spot that these cavities will start to focus on, especially on kids that snack a lot of those type of snacks.
Yeah, I think that everything that you've mentioned have been like really that like toddler phase. And that's anymore food is so accessible. Everything's packaged, everything's convenient. We're throwing everything in our purses in these little bins and whatever. And these kids are constantly snacking. So at that age range, I talk a lot about snacking. So the thing is every time something goes into their mouth, whether it's something like gummy snacks or it could be an apple, that the chemistry of that mouth changes. And suddenly it's gone from a neutral environment to something that's acidic and cavity forming. So kind of think back long ago. Well, not long ago. I mean, even when I was a kid, maybe processed foods and little packaged food was starting to get common. But I mean, I always had Doritos. My mom always had to make my Dorito packages. You know, we didn't have the little separate things all the time. But snacking was a lot harder to do. So, you know, we kind of always got one snack in between each meal. Now kids graze all day long. So every time food and drink goes in their mouth, it spikes. And it takes a half hour to get down below the red zone. So we do 3 meals a day, one snack in between each meal. In theory, we've got 6 spikes that we've got to get under that healthy red zone. Kids who are snackers or grazers, they get their little thing of Cheetos or Goldfish or pretzels even, right? Pretzels have no sugar in them. They're healthy snacks, right? So they get their little bag of pretzels, and that kid snacks on those pretzels for an hour and a half, little bits at a time. And now suddenly we've gone from 6 spikes to this. How many spikes in a given day does a snacker have? They probably never get below that red zone. Do they? Are they never eating? Like, you know, with that and letting their mouth neutralize? Are they never not eating and letting their mouth recover? Right. A lot of kids know. And then the thing that really then takes it home is the juice. And the lidded cups, the straw cups, the sippy cups. And when we start having these early conversations, I don't talk so much about the bottle, but I talk about lidded cups, because if they're lidded, if they have a straw, it makes that beverage accessible all day long. Yeah. So now, so a lot of that focus is on that grazing pattern that we can see certainly in those little carby snacks.
And the fruit pouches too that they sell.
Oh, the fruit pouches, yeah. Yes. I mean, it's like I said, it's just this world of convenience now where everything is so accessible and easy, and kids aren't eating meals anymore. They're snacking all day long on healthy snacks. Right.
Yeah. And the same thing goes with milk also. Right? Yes. Because I have a lot of parents that will say, oh, we just leave the milk out, and they just come and drive by, you know, milk chugs. Yeah. And so one thing that another pro tip here is I encourage my families to have the child sit down at the table whenever they need or want a snack. Not take the snack to their room or to the couch or whatever. If your little kid is hungry, he's like, all right, well, let's go to the table. Let's sit down and have a snack together. And once we're done, that's it until the next meal.
Yeah, that's a great tip.
And the toddlers that still wake up at night and the parents feel they have to give them something to drink. And oftentimes it's juice or milk. And that just lays on the teeth. And I often tell parents, you know, how would you manage yourself if you woke up in the middle of the night and you were drinking milk and putting yourself back down to go to sleep? You probably want to brush your teeth. You wouldn't just be laying down with the mouth full of milk because of all the reasons we outlined already. So you have to sort of treat your children, you know, teeth with as you would treat your own, really.
Right. And with that being in mind, I know this is kind of a different way, but you know, baby teeth, primary teeth are a lot thinner. They're a lot less, you know, strong, and they're more susceptible of developing decay than an adult tooth. An adult tooth enamel is 3 to 4 times, I don't know what the number is, but thicker than a primary tooth.
So a nice thing that I like to tell parents is it takes 6 months for a cavity to form on a baby tooth. It takes 2 to 3 years for a cavity to form on a permanent tooth.
That's impressive.
So it can happen very quickly. Yeah. And back to the snacking, another tip that I again, trying to simplify this for parents because there's so many things. Well, is this snack okay? Is this snack okay?
Right.
I'll say to them, if it's whatever snack they want, give it to them. And a half hour later, check their teeth. Is it stuck on the surfaces of the teeth? If it is, try to avoid that snack. Because there are some cookies that stick in those teeth, Oreos, for example, and then there's some that don't. So saying like cookies are off the table might not be the easiest way, but like try different things. What do you have in your house now? What do they like to snack on? A half hour later, check. If they're still on the teeth, it's really not a good snack to have. Or they can't live without their goldfish. Okay, fine. How about let's throw some carrots in there? So now they're eating their goldfish, but they have the carrots that are crunching and breaking off.
Naturally
because again,
removing.
Looking for.
I thought it was to slow them down because they'll grab it like, oh.
Yeah, right.
Chop them up the same size.
But we're looking for reasonable ways to help these parents get through their days, and should I brush their teeth after each meal? No, but how about just throw some carrots in there? That's going to help. It might not solve it, but it's certainly going to make things better.
Definitely.
Well, I think we covered a lot of information here today on routine oral health for kids, and we hope everyone found it very interesting. And if you like this podcast, please subscribe to our channel down below and obviously leave comments.
Yeah, definitely leave comments. Hit that like button. And coming up, we're going to be talking in different episodes, but binkies are coming up. Common oral pathologies or lesions in the mouth is coming up. Blistered lips is coming up. Lots of good topics. So make sure you stay tuned and keep an eye out for those episodes.
Thank you.
Thanks.
Thanks, guys. Bloopers.
See? That was awesome.
Oh, did it not record?
No, it
No.
didn't. It did.
Yeah,
It better have recorded.
I would have said.
It better have recorded.
Could you
Because that was
imagine?
freaking awesome.
It was.